The leader of Muskegon Family Care has been let go. The board will not renew Daniel Oglesby's contract. Oglesby took over the once struggling clinic that provides health services to some 20,000 Muskegon area residents, the majority of them low income. News 8's Joe LaFurgey has more.
The decision was made by Muskegon Family Care's 10-member board yesterday.
He came in for a short time. It was supposed to be just a short period of time to come in and stabilize the organization, and he did that.
Oglesby declined to appear on camera. When reached by phone, he told me, quote, "I was a bit stunned. I think the board saw me as finished with what I could do," end quote. But Winston says now that finances have been stabilized, the board wanted to move in a different direction.
Increased services, implementing more programs for our patients. At one particular time, just to go back to the cooking classes, the gardening program that they have.
Despite the decision, Oglesby praised the clinic and the board, saying, "I have nothing bad to say about the organization." Oglesby took over 1 year ago as Muskegon Family Care struggled with debt and accusations of mismanagement. Former CEO Sheila Bridges was escorted from the building after she was fired in November of 2019. There were accusations of embezzlement and mismanagement dating back several years. Staff was reduced to skeleton crews, and an announcement was made the clinic would close. Oglesby helped right the sinking ship. He tells News 8 the clinic's deficit was around $13 million when he took over. Millions of that debt has been eliminated. Income from grants and other sources have increased, and so has the number of providers serving the community. "It hurts me because I had a vision for the patients and employees," Oglesby told me. He thinks one reason he was let go was his aggressive approach when it came to attracting and retaining employees. Incentives are needed to attract the right people, especially if they're from out of state. Winston agrees, but while Family Care's budget is in a better place, spending remains a concern.
I understand why he did what he did, but it still doesn't change the numbers. We really were being very, very, very careful on the expenses.
So the clinic has come a long way in the last year. Despite what appears to be a more amicable parting of the ways between the board and the CEO this time, I asked Winston if she was concerned that some in the community might see Oglesby's departure as a warning sign.
I just want to assure the patients and the community and the employees that we are here to stay.
Joe LaFurgey, News 8.